Hello, I'm G. Allen Battle, the founder and conference director of iDeserve Incorporated. We are here for Deserve 2020, a better tomorrow today. I want to welcome you. I'm so grateful that you decided to join us today. And for the rest of this week, I think we've got tons of content that you are going to enjoy. Thank you so much once again for joining us for Deserve 2020, a better tomorrow today. So this year's conference has a specific theme. We're focusing in on HIV and AIDS and continuing that conversation surrounding prevention and care. Today's first session is entitled, Why Continue the Conversation? You will hear from various professionals in their fields regarding why it's important for us to continue this conversation, why we need to continue discussing prevention and care as it pertains to HIV and AIDS. You'll hear from those in rural communities, those in metropolitan communities, those of multiple faith backgrounds, those who work very specifically with this virus each day. And I think that you guys will come to learn quite a bit and become inspired to do your part to end the epidemic. Remember, the chat box is always open, and those presenters are right there in the box, ready to converse with you. So start the conversation. Ask your questions. Engage. We want to talk with you. Remember, registration is open all week long. So maybe you've missed a couple of days. That's okay. You can log on and register today and catch all of the information that you've missed, and it's available until December the 7th. That's December 7th. After December the 7th, you'll have to go ahead and follow us to find out when we will be releasing that information. So remember, if you want to catch this content, December the 7th is the last day to catch this wonderful conference. It airs November 29th through the 5th, and if you're registered, you can enjoy that information through December the 7th. It's absolutely free. Why not register today? Tell your friends. Thank you so much for joining us.
Hi, everyone. Thank you so much for taking time out of your day to listen to me speak. My name is Joshua Kies. I'm a family nurse practitioner, and I specialize in providing HIV care to patients here in Southeast Georgia. I was asked here today to talk about how we can keep the conversation about HIV going and why we should keep that conversation going. And there are some points that I'd like to make. I've been involved in delivering HIV care for about the past 5 years, and we've seen a lot of changes throughout the past 5 years, positive changes, as to how HIV management and prevention is kind of evolving. I think these conversations are so important to have for a lot of reasons. I'm going to limit to talking about 2 today, but I know there'll be other experts kind of talking about other reasons. But I think one of the first reasons is we need to have conversations about HIV to take away the power that HIV stigma has within our communities. Having conversations, even regular conversations, talking over the family dinner table, having conversations at work, talking with friends, with family, just gets people's minds around the idea that HIV is still a huge problem around the world today. I think that especially if we frame things into the perspective of 2020, probably not has been the best year for healthcare in general, but if we look at HIV as compared to maybe a COVID, not much conversation going on about HIV this year. I think we would all agree about that. I think we need to refocus. We need to, again, make sure that our points are coming across as a community to get more information out there. I was just recently graduated with my doctorate in nursing from Georgia Southern University, and I was fortunate enough to do my doctoral project on barriers to HIV care, and I looked at specific barriers within Southeast Georgia. And the information that I gathered was actually quite stunning. Conversations clearly are not happening. There's a social stigma that's attached to even starting these conversations. We have to first understand that HIV is an equal opportunity offender, right? So HIV, although it's disproportionately affecting African Americans within the United States, affects everyone, right? So HIV doesn't matter how much money you have in the bank, doesn't matter the color of your skin, it makes no difference. It's happy to infect anyone, right? So we've got to stay in front of that. I know specifically within Southeast Georgia from doing my research that there are cultural stigmas that add to the regular social stigma of HIV. So looking specifically within the African American community where my research was done, I realized that having these conversations is difficult because HIV is linked to a lot of stereotypes. And I think it's fair to acknowledge these stereotypes. We have to, again, talk about them to overcome them, right? So when HIV is talked about, I think a lot of people automatically think, they must be homosexual, right? What are they doing, in their off time? They seem normal, right? Why are they concerned about getting HIV, right? Everyone, like I was saying earlier, is a potential candidate to get HIV. So we need to get over these social stigmas, these cultural kind of barriers in order to have open dialogue, right? And that's ultimately the goal. When we have open dialogue, if we look at how COVID was handled this year, right? COVID's a virus, HIV is a virus, right? The world came together and recognized COVID as a threat to humanity, right? And lo and behold, within a year, we have a vaccine that's going to be rolling out, right? So back in the 80s, when HIV was first diagnosed, first discovered, why wasn't there a push back then for a cure? I can't answer that. I don't know. I'm glad to say I was only probably 5 years old when it was discovered, but now that I'm older and it's primarily what I do for a living, it makes me pause and really stop and reflect as to why it wasn't given the attention that it so deserved. We can't go back in time, but we can make changes now. So ideas to overcome barriers to get these conversations going. I reached out to churches. My project, again, like I was saying, was focused in Southeast Georgia, so specifically within Chatham County. I reached out to about a dozen churches locally, to pastors and priests and other leaders, social leaders, community leaders. And out of maybe the 25 calls that I made to get information and maybe put community outreach programs together, I received 0 callbacks. So that's a problem. That's a problem. So we need to acknowledge that it is a problem. HIV is still a horrible problem, especially in the Southeast. It's a horrible problem across the country. When we look at the Southeast, we know that our patients, our community, is at a disproportional risk for acquiring HIV. So we need to have the conversations. Conversations that we want to have can be as simple as, I didn't realize HIV is still a problem. What are we doing about HIV? Going to your provider, saying, I didn't realize that I may be at risk for acquiring HIV. Can I get tested? That type of thing. Having individual conversations, moving yourself forward. My goal as an HIV medicine provider is to make sure all of my patients are safe, or as safe as can be. And with the invention of PrEP, pre-exposure prophylaxis, which I'll have the opportunity to talk to you about in just a little bit, we've made great strides over the past decade to help keep people safe. For those that are infected with HIV, again, great strides. No more medication cocktails going on, right? Having to take 5 pills in the morning, 2 with food, 3 without food, 7 pills at night, 6 with food, 4, 3 hours after you've had your last meal. No more of that. Now for most patients, it's 1 pill a day, right? HIV is manageable. HIV is not going to be the disease process that kills our patients anymore, right? So we've made great strides, and I don't want to discount that. But we also have to realize that we can go further, and we can make even a greater impact within HIV medicine to better care for our patients. So, in order to do that, again, we're going back to having conversations. Conversations, individual conversations at the community level. It's what brings about change, right? That's what brings about change. So, I would highly encourage you, if you're at all interested, I take it that you may be interested, reaching out for more information because you may be watching this. I implore you to have these conversations with your loved ones, right? Family members, friends, just to get the conversations going. Talk to your providers. Do they offer HIV screening, right? What do the community health departments offer? That may be an option for you. Have the conversations. We need to talk about HIV and how it's progressing. Again, we're not discounting the strides we've made in HIV medicine over the past decade, but we need to do more, especially when we compare it to COVID, right? And the strides we've made in less than a year with COVID. I think if we're switching gears with conversations, I think we also need to think about how we're approaching our providers too, right? And I think I alluded to this a little bit earlier. We want to make sure that we're having open and honest dialogues. In the South, where I went to school to be a nurse practitioner, and we're taught how to do complete head-to-toe assessments, get a thorough medical history. Sexual history never came up. Wasn't part of what we were told to assess. That's a problem. I think there are a lot of assumptions made about people, and there's a little bit of discomfort. You know, we have these uncomfortable conversations with patients to try to get information, right? But we need to get out of our comfort zone to get more information. That's the bottom line, right? So, if your provider doesn't offer HIV testing, chooses not to offer prevention services, right? Maybe it's time to look for another provider, right? HIV is part of a holistic care, a plan of care, right? So when your provider is looking at you, they shouldn't be looking at one aspect, right? They should be looking at you as a person. And how can we best take care of this person, right? How does that happen? Conversations, that's how it happens. We need to keep the conversations going. The more conversations patients have with their providers about HIV, the more important HIV will be to the provider, right? So we need to keep those conversations going. From a financial kind of perspective, we know that pharmaceutical companies are businesses, right? And they're out to, ultimately show the stockholders that they can make a profit, right? But keep in mind, with things like PrEP, pre-exposure prophylaxis, someone is infected with HIV, that there are assistance programs to keep you connected with your provider, right? So at this point, there's no excuse to not get proper either preventative HIV care or stay linked to your HIV provider if you are infected with HIV. Again, we're having these conversations within our families. We're expanding the conversations to community level events. And all of these conversations will eventually grow, hopefully, into national movements where HIV gets the attention it deserves. I'm very passionate about HIV and providing my patients the best possible care. If HIV claims one life a year, it's too many, right? So we need to have the conversations. I appreciate you letting me take some time today. I look forward to speaking to you about pre-exposure prophylaxis, and my contact information will be available in the booklet that is attached to this series. Again, my name is Joshua Kies, and I look forward to hearing from you. And should you have any questions, concerns, anything, please don't hesitate to reach out. Thank you so much.
Hi, I'm Dr. Debbie Hagins here in Savannah, Georgia, and I'm here to address the question, why do we need to having the conversation about HIV in the year 2020, 40 years into this epidemic and in the 21st century? And I have given this question some thought. While the answer seems very obvious and very clear to myself and others who are in this fight to end HIV, to fight the stigma and discrimination, to dispel the myths about HIV and AIDS, I'm reminded of the adage, out of sight, out of mind. I'm also reminded at this time, as an employee of public health, we undergo annual trainings, and we review the same important information year after year. HIPAA, hurricane preparedness, child abuse reporting. So because I've been in this agency for at least 20 years, I have at least 20 certifications that I have reviewed HIPAA and all of those necessary requirements. And the reason that we have to keep having the conversation is because we certainly need to keep the next generation coming behind us in the know. They need to understand the struggles that we have overcome, the battles that we have already gained some advance on, or some advantages that we have already succeeded in. But then we still have a long way to go when we look at the number of new infections. We have come a long way since the early 1980s. When I think about out of sight, out of mind, I think about the daily deluge. When we think about the number of emails we get every day, we think about all of the events that come onto our plate and our schedule every day. It's easy to see how things that are really important can be pushed out or be overshadowed. And we have to keep shifting our priorities. Everybody can't be in the fight against HIV to the same level of dedication and time and commitment, because there are other important issues facing not just our families, our communities, our states, our nations, but the world. And I think about cancer research, I think about diabetes, I think about a lot of other illnesses that have a negative impact on the people of the world. So we need to keep having the conversation because we need to keep it fresh. We need to keep it in our thoughts. And this is one thing that I have learned, that anytime something remains on your mind, anytime something is always confronting you, even when you go to sleep at night, those little gray cells begin to work on the problem, And then we become very, very creative. We come up with new ideas and new solutions. So until we are able to say that we have won this war, that we have been successful, that we have achieved a desired goal in our fight against HIV. And then after we reach that goal, of course, we have to set a new goal. It is in our human nature, of course, to keep striving. And while we have those around the world, the globe, in this fight who are dedicating countless hours, and I'm going to tell you something, there is always someone in every hour of the day who is focused on ending, fighting, dispelling HIV myths. Because as I think about the sun setting, I think about how we evolve, and I know that right now, I know Hawaii is 5 hours behind us. I know that London is 5 hours ahead of us. I know that Australia is 18 hours ahead of us. Someone is always engaged in some aspect of bringing an end to our fight. Yesterday, when I was talking with one of the interviewers, I talked about a song that Donald Lawrence had recorded, and it came to my mind when I first started in my journey with fighting and making people aware about HIV, having conversations at the dinner table, having conversations with my family at family reunion, having conversations at church gatherings about the impact HIV is having, especially in a disproportionate manner, to communities of color, and beginning to try to educate them that everyone is potentially at risk, and talk about what the risk factors are and what it is and what it isn't. So until we have achieved that desired goal, we need to keep having this conversation. And I am so thrilled that this event is going virtual, it's going public. And you know what I think about? When we think about something going viral, we think about it in a positive way, that it has so many hits and people keep watching it. And to me, it's kind of comical, because we're talking about a viral infection. And we certainly want this to go viral in terms of raising awareness, and that it's going to reach someone. It's going to keep somebody who is HIV negative, it's going to keep them negative. It's going to keep somebody who's HIV positive engaged in care, linked to care, living the best life possible, because every life does matter. So I thank you for this space of time, and see you on the other side of victory. Thank you.
Hello, my name is Katrina Howard, and I am a lead communicable disease specialist with the Coastal Health District. I've been working in public health for almost 10 years. So why do we continue the conversation of HIV and AIDS? Why do we need to continue talking about prevention and care? Well, why not? As a young child, I was raised by a single mother who worked in public health for almost 36 years. I can remember going to health fairs playing with condoms. Did I know what condoms were at the time? No. But that was the moment that my mom felt like she was introducing me into the world of healthy lifestyles. You know, I felt comfortable going to my mom, asking about my health, having questions, STDs. What is that? What does it mean? So I grew up in a household where there were no barriers. Everything was comfortable for me. But shortly after, I realized everyone didn't have a household like that. See, it starts from the home. So you think back to our high schools. I mean, we talked about STDs, right? But you really didn't go in detail about it. You just learned what it was. You didn't learn how to prevent from getting it, right? So why do we continue the conversation? It's just as important. Look at HIV now. Look where we've come over the years. We now can prevent pregnant women from becoming their babies from becoming infected, right? We're at a point now PrEP is available. So if I want to take a pill once a day to prevent myself from becoming HIV positive, that's available as well. So we need to continue the conversations. We need to continue to talk about it with our providers, in our homes, why should we continue the conversation? HIV and AIDS became personal for me when it hit home with a family member. The stigma that my family member experienced amongst her individual family, it was awful, but it was due to lack of education, knowledge. That's why I'm in this field as we speak. So HIV and AIDS is very important. It's not just for those infected, but affected, right? Prevention is also important. Think about in our communities, how often do you see someone providing free HIV testing, right? How often do you see a sign on the side that says HIV, some statistics about HIV? We see a lot of no smoking, chronic illnesses, but HIV is still a stigma in our communities. I can remember my mother providing free STD testing down in Glenn County, and it made headline news. Why? Because there was stigma behind the STD testing. That big sign that was up there was a big issue. So we need to continue the conversations. Okay, what does stigma look like? Stigma, a lot of times, is judged by the way you carry yourself, your sexuality, if you're promiscuous or not. There's an assumption of your demeanor, whether your religious aspects. I think there's stigma naturally in our communities as a whole. How many people you know is not willing to go to a health department just because of the stigma at the front door? The way you were treated involves stigma. How do we combat stigma? A lot of times, of course, we're doing trainings and we're trying to provide information of how not to, for people to experience stigma, but I think that becomes a personal decision. You have to make it in your mind that I'm no longer going to judge a person by the way they carry themselves or the way their sexuality is. You have to make a personal decision of yourself that I'm going to treat everybody equal, and that's kind of hard to do sometimes. So we have to continue to provide education, trainings, and try to encourage people like the way you treat others really hurts a person's experience in a clinical setting, for instance, or even at a church. We have to have a more of an open mind when it comes to stigma. So the testing that my mother provided when I was young, she did work in a public health setting that was predominantly African-American population. STD screenings included gonorrhea, chlamydia, syphilis, and HIV. So my mom worked in an era where HIV definitely was not as common back then. A lot of people assumed that their life had a short time frame back then. But my mom was passionate about it. She was one of those nurses that it didn't matter if you got to that clinic at 4:55, she was going to make sure that she saw you no matter what, because she felt like if you stepped in her clinic, there was a reason for it, and she wanted to address any of your concerns. And I know for a fact that's where my passion comes from seeing her work over and beyond no matter what. How can I continue that legacy? I'm actually doing it now. I make sure, working in public health, we all know it's not about the money. You have to have a passion to be in public health. You have to be considerate of others and their services and what they need. And so I continue to do that. I've been working for public health for almost 10 years now. And I love what I do. I love that I'm able to make a difference in people's lives. I'm able to encourage them and let them know that there is life after a diagnosis. So what would I say to a community just starting this conversation? To have an open mind, to do your research, see what resources are out there. Matter of fact, look into the resources that your community doesn't have. A lot of times people don't get their services because the resources are not there. I think as a community, we got to start building our healthcare sector, our health departments. We even need to support our health departments, right? We have to get ourselves to a point where we are providing services for all, no matter what. So why should we continue the conversation of HIV and AIDS and care? At this point, we have come a very long way. We are at a point in our life now where I believe we are almost at a cure, right? So we have to keep going, keep pushing ourselves, keep educating our communities, keep providing free HIV and testing, expanding our HIV care to a point where even our providers are confident that when someone comes into their clinic, they know they're going to be taken care of. Our PrEP clinics need to expand. We should not only have 2 PrEP clinics in an 8 or 9 county district. We have to all get on one accord, come together, and make a difference as a whole. So that concludes my conversation. I thank you so much for the opportunity. And don't forget, continue those conversations. Have a great one.
Hello, my name is Chauncey McGlathery. I'm from Huntsville, Alabama. Glad to be here today. The question I was asked to address is, why continue the conversation? Well, there's many reasons, actually. First of all, not everybody who's being impacted by HIV and AIDS is even engaged in the conversation. And some of that is because of a cultural reticence. Some of that is because of political differences. But for whatever the reason is, until everyone is invited to the table, we're not addressing our entire problem. Another reason to continue the conversation is for those people who are aware of their conditions. Not all of them are in care, and that could be a complicated problem to solve, but resources have to be shared. And I believe every opportunity that we have to do better than we did the day before is worth another day. Every battle that we fight is an indication of a greater war. And we have dominion and authority over every challenge that comes against us. What sometimes bothers me is the willingness that we have to sacrifice those people who we deem as not as important or not as valuable as someone else. Well, who makes that determination, right? I know I didn't, right? Those of us who are made in the image of God and aware of the power of God and connected to the love of God, we know better, right? We have to talk to everybody about saving everybody. And until we do that, we're not having the conversation. Another problem is there are people who have power who enjoy deciding who gets care first. That's ridiculous. It's part of our political system, but we can do better. And I think until we begin to make this conversation every day, at every table, involving every interested party, we've only scratched the surface. We cannot be satisfied with just a little success. We only have to be satisfied with complete success. And that's not going to happen anytime soon. We've made a great dent. We've made a lot of progress, but we have far longer to go than we've even begun to travel. And what I found, most of that reticence isn't external. It's internal. Because truth of the matter is, some of us have been hurt so much in our society and dealing with all the foolishness that is the American healthcare system that we decide that we must not be worth the fight. Now, if you don't think you're worth the fight, how is anyone else going to think you're worth it? It's incumbent upon all of us to circulate this truth that there is no lesser, there is no inferior, there is no one who is not worthy of the opportunity to live a full and healthy life. And nothing that anyone has done in the past changes that reality. And I'm going to address one more thing. If the faith community would stop clamoring for power and control and let God be God, then we wouldn't have gatekeepers who see themselves as having value by stopping a free flow of information and ideas. Sometimes those of us who participate in faith communities deem ourselves as representatives of God in a way that tries to decide who gets help and who doesn't. And honestly, I'm sick of it. I think it's a betrayal of our very nature of the image that we were made in. So we have to continue the conversation for our very redemption, if for nothing else than to be the people that we were created to be.